get a needle stabbed in
Hold on, I want to be able to use it.
I'm nervous, Mary. Why do you always give me a
Hold on, trade sides.
Hello everyone, and welcome to this episode of Steve's Horse Show. Today, I'm gonna show you a little acupuncture. I'm not going to, she's going to. She's gonna walk us through how to stab a horse, basically, nicely with needles. And she's gonna walk us through the process. Take me through the process of, first off, why would you acupuncture a horse in general? Why would someone need to do this?
So acupuncture is used for a lot of different reasons. So musculoskeletal problems, even anxiety, depression, skin allergies. I mean, any.
Did you say anxiety, depression?
Yes.
In a horse?
Well, mostly in dogs and cats.
Okay, okay.
Yes.
And you said what else? Sorry, I cut you off. I'm bad at that.
Skin allergies, arthritis, ultimately anything you can treat with modern medicine, there are methods to treat with traditional Chinese medicine.
Okay, and so you alluded to before we got started how you find places that you want to, what you would call maybe focus in on, and stuff like that. So show me how you do that. Give the background of this horse first before we start.
So this horse, her name's Lori, and about a week and a half ago, she tied up, which is where the muscles contract and can cause muscle cell damage. There's a lot of problems that can result as consequences of the horse tying up, like kidney failure, laminitis. So she was not responding as well as we liked to our modern medicine, fluids, NSAIDs. So we integrated acupuncture into her treatment plan, and we're able.
Okay, so you started with that, and then you're looking for more abilities to help her out.
Yes. So
okay.
We integrated 2 acupuncture treatments, and significantly, she improved afterwards.
And is that really the truth? Like, do some horses respond better than others, or is it they all kind of respond?
It really just depends on the nature of the disease process. So obviously, if you have some chronic bony degenerative changes, you can't anatomically fix that with acupuncture.
Gotcha.
But as far as the actual sensations of pain, nerve damage, or things like that, you can.
That's where it's most helpful.
Then I do what's called scanning the horse, and so every doctor is different. Usually, I'll start at the head. And so I'll check their pole. So this
show the cool thing.
This isn't really that special. It came off Amazon Prime.
So you can do this yourself. Just kidding.
No. So this is a Korean ear probe. They actually use it on people. And so I'll check the pole of the horse, and you can see she's not sensitive. The jaw, so horses that have teeth. So she's mostly sore along her back. And so this point I'm doing right here is going to be bladder 21. And so if you want to zoom in on that. So these needles are actually 3 to 4 inches long. On her, I've been using the 3-inch needles. On like a 1,200-pound quarter horse, we would probably use the 4-inch needles. So their back muscles are really, really thick, and you have a lot of tissue to penetrate through. So you're not going to puncture anything vital within the abdomen.
Way too long.
Yeah. It's not.
Like, just like in my, uneducated,
Sometimes.
At first, did you think like, no way? Or did you like assume that was fine?
The length of the needle?
Yeah.
I think just because
I've never seen it done, so I didn't have any background to it. But.
So see, sometimes when they react to a point like that, it's because they're sore. And so this needle, I'm going to go ahead and feed it in. It will probably be bent when I pull it out because the muscles will actually contract and release around the needle. And so that's something that you will see happen. So that doesn't necessarily mean that you didn't have an effective treatment. It just means that that was a really sore spot.
Gotcha.
So this point here is for hind end problems. So stifle or hock pain, foot pain, and you can usually tell if
what are you putting the needle into? Just the muscle or?
Just the muscle. So you're not trying to come in contact with nerves or blood vessels. You especially want to avoid blood vessels ideally. These needles, I'm not just willy-nilly placing them. They actually correspond to meridians within the body that have been studied centuries and centuries that derive from traditional Chinese medicine. And so each of these points correspond to a problem and will help in some way. This one we may get a reaction, may not. This is not her sorest foot, so. So you have to be really fast. So we're gonna let these sit for about 15 minutes, and then we'll take them out and we'll rescan her and see if she's still responsive over her back like she was earlier.
Man, I got a flash of like, we're on a cooking show and you're like, we're gonna let this sit for about 15 minutes.
Well, I stopped myself from saying
we've already baked one an hour ago.
I always count them before or when I'm done. Because
I would have never thought about that.
Yeah, that's why I counted them. So
that's why I'm not poking your horse. She is.
They can get lost, especially in dog's hair.
Ooh.
So,
ooh, that's sore.
Yeah, this one's tight. This one's going to be bent a little bit. So look at that.
And why does that happen?
So as I was inserting it, she was contracting and relaxing her muscles, and
Gotcha.
so you'll get.
Is that good, bad, and different?
It just means it was a very sensitive point. So do you think she's sore over her back now?
Gotcha. So that's what, like, the first time you did that, she was like...
Yeah, she was like, oh,
yeah.
That is so uncomfortable. And so what we would expect from her today is she'll be put back up and she'll probably sleep most of the day and lay around a lot and then be really active the following day. So that's typically what you'll observe. Just so you can see what it feels like.
I'm nervous, Barry. Why do you always give me... Don't you... I'm about to get a needle stabbed in me.
Hold on, I want to be able to use a tube.
She's like, hold on, let me get a bigger one. I need to make sure that's the smallest one you got.
Do you need to like bite down on a rope or something?
I'm okay.
Okay. What do you want me to say?
Harry, nothing, just hit it. There's nothing to be said now.
This is just to show, so you can understand.
Is the camera visibly shaking?
It does not hurt.
Can you see it?
Okay, you're gonna take a deep breath, not exhale. Did you even feel it?
Is that it?
Oh my God, you have a needle in you.
Oh, that was nothing. I expected it way more.
No, you can like move your hand and
I'm
stuff
already
too.
more relaxed. My headache went away. I'm smarter.
I'm smarter. I don't think it works. Yeah, you're gonna yawn.
Forgot how to get home.